tonight's Medical Watch, it's not something schools test for any longer, and straightening out the problem can be tricky. A simple screening you can do at home may help.
I love swimming. I've been doing it since I was 4.
In the water, she flies. In the stands, her parents cheer. And it was from the sidelines where Megan Falconer's mom first noticed the strange shape of her daughter's spine.
She said it looked a little funky, that we should probably go and get it checked out.
She had a sort of what we call a double curve here.
Orthopedic surgeon Dr. DeWald diagnosed Megan with scoliosis.
We see it in about 3% of the population. Only a small percent of those will continue to get worse, but it's growth that tends to make idiopathic scoliosis get larger.
Megan began wearing a back brace at age 7, the first line of defense for treatment. But as she grew, so did the curve in her spine. By age 12, it was clear she'd need more. The curve had progressed to 50 degrees.
But the curve sometimes still gets larger even though they're wearing the brace. When you stop growing, if the curve is less than 30 degrees, it tends not to be a problem. If the curves are over 50 degrees when you're done growing, when you start getting to that level, you start to have problems with lungs and your cardiac function. So some of those we have to then eventually consider surgery for.
Like Megan, today her 10-inch scar is barely visible, an external reminder of what lies inside, an intricate grid of metal rods and screws.
Think of the rods more like an internal cast. And that is, it holds the spine together as the bone fuses. And we're putting a number of these screws along here and along the other side. And then we're going to, as we put the rod in, we're going to slowly pull it. So imagine a rod here. It's going to be slowly straightening out like this. The
end result? In Megan's case, a 10-level fusion of the bony vertebra.
Is it absolutely perfect motion? No. And my restrictions would be gymnastics and contact sports. Yeah. Swimming, I'm okay with.
A big relief for this lifelong competitive swimmer, even though it took years after surgery to regain her fighting form. Still, scoliosis didn't sink her hopes for the future.
I had to slowly ease into the other things like flip turn and diving in. It's my goal this season to qualify for state. Last year I just made it in relays, which was really fun, but this year I'm really hoping for some individuals.
Megan's treatment may have been complicated, but it started with a simple test, one parents can do at home with their kids. And if they suspect scoliosis, in 75% of cases, early intervention with a brace is the only treatment necessary.
What we're really looking for is a rotation. To look at their shoulders. Is one side higher than the other? Second thing we want to look at the shoulder blades. Is one more protruding than the other? Next thing we want to do is look at their waist. And we look at their waistline by taking a look at this side compared to here to see if they look symmetric. We want to look at her back and see if one side looks higher than the other. And she looks very symmetric and is normal.
Scoliosis tends to run in families. There's a newer genetic test called a SCOLI score. It's a simple saliva DNA test that tells doctors if patients are at high risk for progression.